Stop right there before you take another vitamin. If you're over 60, some of the supplements sitting in your medicine cabinet right now could be doing more harm than good. I'm talking about popular vitamins that millions of seniors take every single day, completely unaware of the dangers lurking inside those innocent-looking bottles. Today, I'm going to reveal the 4 vitamins you should absolutely avoid after 60, and more importantly, the 4 essential ones that could add years to your life. This information could literally save your health, so stay with me until the very end. Welcome to Dr. Mandell Motivates, where we empower you with the knowledge to take control of your health and live your absolute best life. I'm here to cut through the confusion and give you straight answers based on science and decades of clinical experience. If you're new here, make sure to subscribe and hit that notification bell, because we're building a community of health-conscious individuals who refuse to let age define their vitality. Before we dive in, I need to make something crystal clear. The information I'm sharing today is for educational purposes only. It is not intended to diagnose, treat, cure, or prevent any disease, and it should never replace the advice of your personal healthcare provider. Everyone's health situation is unique, especially if you're taking medications or have existing health conditions. Always consult with your doctor before making any changes to your supplement routine. Now that we've covered that, let's get into the vitamins that could be sabotaging your health. Let me start with something that might shock you. Just because a vitamin is popular or heavily marketed doesn't mean it's safe for you. In fact, as we age, our bodies change dramatically. The way we absorb nutrients shifts, our liver and kidney function can decline, and our medication list often grows longer. This means supplements that were perfectly fine in your 40s or 50s might become problematic after 60. The first vitamin you need to be extremely cautious about is vitamin E in high doses. Now, I know what you're thinking. Vitamin E is an antioxidant. It's supposed to be good for us, right? Well, here's the truth that the supplement industry doesn't want you to know. Multiple large-scale studies have shown that high-dose vitamin E supplementation in older adults, particularly doses above 400 IU per day, can actually increase your risk of heart failure and hemorrhagic stroke. Let me explain what's happening in your body. Vitamin E is a blood thinner. When you're over 60, many of you are already on blood-thinning medications like aspirin, warfarin, or newer anticoagulants. When you add high-dose vitamin E to the mix, you're creating a potentially dangerous situation. Your blood becomes too thin, increasing your risk of serious bleeding, especially in the brain. I've seen patients come into the office with unexplained bruising, and when we review their supplements, there's that high-dose vitamin E staring us right in the face. But here's what's even more concerning. Research published in major medical journals has shown that high-dose vitamin E doesn't provide the heart protection benefits it was once thought to deliver. In fact, it may increase all-cause mortality in older adults. Your body needs vitamin E absolutely, but you should be getting it from food sources like nuts, seeds, and leafy greens, not from megadose supplements. The second vitamin on our danger list is vitamin A in the retinol form, especially in doses exceeding 5,000 IU daily. This one is tricky because vitamin A is essential for vision, immune function, and skin health. But here's the problem. Vitamin A is fat-soluble, which means your body stores it in your liver and fat tissues. It doesn't just flush out like water-soluble vitamins do. As we age, our liver's ability to process and eliminate excess vitamin A decreases. When you take high doses over time, it builds up in your system, leading to a condition called hypervitaminosis A. The symptoms can be serious liver damage, bone weakness and fractures, vision problems, and even increased pressure in your brain, causing severe headaches and dizziness. I've had patients tell me they're taking vitamin A because they want to protect their vision as they age. The irony is that too much vitamin A can actually damage your eyesight and weaken your bones, increasing your fracture risk at a time when your bones are already becoming more fragile. If you're eating a balanced diet with colorful vegetables, you're getting plenty of beta-carotene, which your body converts to vitamin A as needed. You don't need those high-dose supplements. Now let's talk about the third dangerous vitamin, and this one surprises a lot of people. It's folic acid in high doses, particularly synthetic folic acid in amounts exceeding 400 micrograms daily without a specific medical reason. Wait, you might be saying, isn't folic acid something pregnant women need? Absolutely correct, but what works for a 30-year-old pregnant woman is very different from what's appropriate for someone over 60. Here's what the research is telling us. High doses of synthetic folic acid can mask a vitamin B12 deficiency, which is already common in older adults. When you have low B12 but you're taking high-dose folic acid, your blood tests might look normal, but meanwhile you're developing irreversible nerve damage. By the time the neurological symptoms appear, such as numbness, tingling, balance problems, and cognitive decline, significant damage has already occurred. Even more concerning, some studies have suggested a link between high folic acid intake and increased cancer risk in older adults, particularly colorectal cancer. The folate you get naturally from leafy greens, beans, and lentils is chemically different from synthetic folic acid, and your body handles it much better. Unless your doctor has specifically prescribed high-dose folic acid for a particular condition, you should avoid those mega-dose supplements. The fourth and final vitamin to avoid is iron without a diagnosed deficiency. This is huge, and I cannot stress this enough. After age 60, especially for men and postmenopausal women, routine iron supplementation can be downright dangerous. Your body has no natural mechanism to eliminate excess iron. Once it's in there, it accumulates in your organs, particularly your heart and liver. This iron overload creates something called oxidative stress, which accelerates aging and increases your risk of heart disease, diabetes, liver disease, and even certain cancers. I see so many older adults taking multivitamins with iron or standalone iron supplements because they think it will give them more energy or prevent anemia. But unless you have documented iron deficiency anemia confirmed by blood tests, you should not be taking iron supplements. Here's what you need to understand. Fatigue in older adults is rarely caused by iron deficiency. It's usually related to other factors like poor sleep, medication side effects, thyroid issues, or vitamin D deficiency. Taking iron when you don't need it won't solve your fatigue, but it could create serious health problems down the road. Now that we've covered the vitamins to avoid, let's shift gears and talk about the 4 vitamins you absolutely must consider taking daily after 60. These are the game changers that can help you maintain your independence, protect your brain, strengthen your bones, and keep your energy levels up. The first essential vitamin is vitamin D3. This is non-negotiable, and here's why. After 60, your skin becomes less efficient at producing vitamin D from sunlight. You're spending less time outdoors using more sunscreen, and your kidneys aren't converting vitamin D to its active form as effectively as they used to. The result, an estimated 70 to 80% of older adults are vitamin D deficient. Vitamin D is absolutely critical for bone health, immune function, mood regulation, and muscle strength. Low vitamin D levels are directly linked to increased fall risk, fractures, depression, cognitive decline, and a weakened immune system. I recommend most of my patients over 60 take between 2,000 and 4,000 IU of vitamin D3 daily, along with regular blood testing to ensure optimal levels between 40 and 60 nanograms per milliliter. Take your vitamin D3 with a meal that contains some healthy fat because it's fat, soluble, and absorbs much better that way. Pair it with your breakfast if you're having eggs and avocado, or with dinner if you're having salmon. This simple daily habit can dramatically reduce your fracture risk and keep your immune system strong. The second must-have vitamin is vitamin B12 in the methylcobalamin form. This is absolutely crucial, and sadly, it's one of the most commonly deficient nutrients in older adults. Here's what happens as you age. Your stomach produces less stomach acid, which is essential for absorbing B12 from food. Many seniors are also on acid-reducing medications for heartburn or reflux, which further impairs B12 absorption. B12 is essential for nerve function, energy production, red blood cell formation, and brain health. Deficiency leads to fatigue, memory problems, depression, balance issues, and permanent nerve damage if left untreated. I recommend older adults take at least 500 to 1,000 micrograms of methylcobalamin B12 daily. This form is already in the active state your body needs, unlike cyanocobalamin, which requires conversion. You can take B12 as a sublingual tablet that dissolves under your tongue, bypassing the stomach absorption issues altogether. Many of my patients report dramatic improvements in their energy levels and mental clarity within just a few weeks of starting B12 supplementation. The third essential vitamin is vitamin K2. Now, most people have never even heard of K2, but it's absolutely vital for healthy aging. While vitamin K1 is involved in blood clotting, vitamin K2 has a completely different job. It activates proteins that direct calcium into your bones and teeth where you want it, and keep it out of your arteries and soft tissues where you definitely don't want it. Think about it, you're taking calcium for bone health, maybe vitamin D to help absorb that calcium, but without K2, that calcium might end up calcifying your arteries instead of strengthening your bones. This is one of the reasons we see older adults with both osteoporosis and arterial calcification at the same time. The calcium is going to the wrong places. I recommend 100 to 200 micrograms of vitamin K2 in the MK7 form daily. This works synergistically with your vitamin D and calcium to build strong bones and keep your cardiovascular system healthy. Just one important note. If you're on blood-thinning medication like warfarin, you need to talk to your doctor before taking K2 because it can affect your medication dosing. The fourth and final must-have vitamin is vitamin C. Now, unlike the fat-soluble vitamins I warned you about earlier, vitamin C is water-soluble, which means your body eliminates excess amounts. It's very safe, and it's incredibly important as you age. Vitamin C is essential for collagen production, which keeps your skin, joints, and blood vessels healthy. It's a powerful antioxidant that protects your cells from damage, supports your immune system, and helps you absorb iron from plant foods. As we age, our body's antioxidant defenses decline, making us more vulnerable to oxidative stress and chronic disease. Vitamin C helps fight this process. I recommend 500 to 1,000 milligrams of vitamin C daily, split into 2 doses for better absorption. Take it with meals to minimize any stomach upset. Some of my patients have reported fewer colds, better skin quality, and improved wound healing after consistently taking vitamin C. It's one of those foundational supplements that supports so many different aspects of your health. Now, I want to tie this all together for you. Your vitamin strategy after 60 should be about precision, not excess. More is not better when it comes to supplements. In fact, as we've discussed, more can be dangerous. Focus on avoiding those 4 risky vitamins. High-dose vitamin E, excess vitamin A as retinol, high-dose synthetic folic acid, and iron without a deficiency. At the same time, make sure you're getting adequate amounts of the 4 essential vitamins D3, B12, K2, and C. But here's something else I want you to understand. Supplements should never replace a healthy diet. They're meant to supplement, not substitute. Focus on eating a rainbow of vegetables and fruits, lean proteins, healthy fats from nuts and fish, and whole grains. Drink plenty of water, get regular physical activity, prioritize quality sleep, and manage your stress levels. These lifestyle factors are the foundation of healthy aging. I hope this information has empowered you to make smarter decisions about your vitamin routine. Your health after 60 is not about luck. It's about making informed choices based on solid science. If you found this video valuable, please give it a thumbs up and share it with your friends and family who are over 60. You might just save someone from a serious health problem. Don't forget to subscribe to Dr. Mandell Motivates and turn on notifications so you never miss our content. We're here every week bringing you the latest science-based health information to help you live your strongest, healthiest, most vibrant life at any age. Drop a comment below and let me know which of these vitamins you're currently taking. Are you surprised by anything you learned today? I read every single comment and I love hearing from our community. Remember, age is just a number. Your vitality, your energy, and your health are in your hands. Make every day count. Take care of that amazing body of yours and never stop learning and growing. Until next time, this is Dr. Mandell reminding you to stay motivated, stay healthy, and keep living your best life. I'll see you in the next video.